thyroid gland. I'm making 7 short videos, little sound bites talking about various parts of thyroid problems. How do you know if you have them? How do you test for them? What are the symptoms? Various things like that. So follow this little series along. There will be back videos if you want to watch them, and I'll continue with a few more videos just discussing thyroid stuff. Thank you for watching. Please like the video if you have a chance so that it will be more available for people to find it if they want to watch this video. If you would like to receive more, please subscribe. I'm going to be making series of videos about various health topics. So that being said, please share this with your friends and family if someone might have a thyroid problem, or just interested in natural medicine, or interested in how a detective thinks about health problems, because I'm thinking more and more that I'm kind of like a health detective. Once you find out what the cause is, the fix is pretty simple. So how do you know if you have a thyroid problem? You have to do some testing. So the main test people think about is a blood test. Blood test is going to tell you your thyroid level, hormone levels in the blood. Is the thyroid hormone too high, too low? Maybe you have some antibodies in the blood against your own thyroid gland. That would mean you have a Hashimoto's disease or some autoimmune stuff going on. You can also check for the thyroid stimulating hormone, which is the hormone coming from your pituitary down to tell the thyroid what to do. You can get some clues about stuff like that. I wanted to mention that the blood testing is not perfect by any means. In fact, I kind of find that it is prone to letting you feel like there's no thyroid problem. I have a lot of people who come to my office who say, you know, I felt like I must have a thyroid problem, but they did a blood test. Here's my blood test, and the results say there's no thyroid problem. And then we do further investigating, and we find, yes, they do have a thyroid problem. It just wasn't showing on the blood test. And we do some therapy towards getting the thyroid improving, and they start to feel great. So the blood tests are prone to missing the issue in some ways. I'm sure there's going to be some better blood tests discovered in the next few years, and people will go, oh my goodness, how are we we were losing a lot of people to the wrong direction here by thinking their thyroid was okay, when in fact it was not okay. So, but blood tests are a great place to start. The other way to test is applied kinesiology. It's my favorite, easiest way to quickly tap into the nervous system, the brain. Ask the brain, hey, what's going on? Is the thyroid doing well or not? So in just a minute or so, you can get some feedback via the nervous system and find out what's going on with the thyroid gland, get some directions. My favorite way, actually, is listening to what your symptoms are. That's probably the best way of knowing what's going on. Do you have a bunch of the symptoms that the thyroid gland is the culprit for? And you could do a survey. You could go online and find a survey for symptoms of thyroid problems. If you have a bunch of those symptoms, you have a thyroid issue. You don't even have to worry about the blood test. If it says no, then the blood test has missed something, as it often does. So having a symptom survey where you check yes, 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 or no, 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 no for thyroid symptoms is one of the best ways for knowing if you have a thyroid problem or not, actually, is just by the symptoms. Because I think the blood tests are missing the boat in some ways. But the blood tests can give some good information. I just don't trust them if they say, no, there's no problem at all, and you have a long list of complaints. So those are really the 3 ways that you can mainly test for thyroid problems. Also, medical doctors will maybe do an ultrasound of your thyroid, checking for lumps and bumps, checking to see if there's something that might be cancerous going on. But I'm just talking about general functional testing. Is your thyroid functioning in the optimum range? Is it under-functioning? Is it hyperactive? Those are the general questions that I'm interested at as kind of a natural medicine doctor. So those are some of the tests that you can order. Again, the best one I think is the last one. Is just, what are your symptoms? Do you have 10 or 15 symptoms of thyroid problems? Pay attention. It's probably just a good old thyroid problem. Then it needs to be addressed. So share this video if you know someone who has some symptoms of thyroid problems. That was in a previous video. If you have questions, ask questions. I'll do my best to answer your questions, or I'll make a video about it if people ask enough good questions. I'll see you on another video.